Hello, my name is Henry Sullivant. I'm a practicing obstetrician gynecologist in Memphis, having been with the Ruck Clinic for many years. I'm coming before you to tell you several things. One, after 30 years of practicing gynecology and obstetrics, I'm going to be leaving the Ruck Clinic and taking over a new position as Chief Medical Officer for Select Health Alliance. Many of you receiving this message, and I appreciate you opening up a YouTube video with my face on it, probably terrifies you, but many of you getting this message are already familiar with Select Health Alliance and understand the project that's been ongoing now for almost 3 years. Others of you getting this may have heard some may have not. Regardless of your level of information, learn more about this. This is probably one of the most important physician-led projects in this region that I have seen in 30 years of practicing medicine. Like I mentioned, Select Health Alliance is a physician-led clinical integration project. It was started about 3 years ago by a group of physicians brought together by Baptist Hospital. Baptist has provided the financial support to help get this project off the ground. Currently, we have almost 900 doctors enrolled in Select Health Alliance, with a plan to grow the network to over 1,200 doctors in our metropolitan region. Many of you are familiar with clinical integration and its concept, but in clinical integration our goal is, as a physician and hospital network, we're hoping to improve the efficiency of care, look at how well we are rendering care both from a cost standpoint and a quality standpoint, and by doing so we feel that we're going to be able to improve patient satisfaction, improve outcomes, and ultimately, hopefully, save healthcare dollars. Select Health Alliance is comprised of physicians, many of whom you are very familiar with, many of whom you practice side by side with for years, composed of a large network of physicians aligned with the hospital. The intent there is to treat the entire continuum of care of the patient, both from your office to the hospital and then back to your office, and make sure that we have proper information that can be moved seamlessly through this network. Look at inefficiencies such as redundancy of tests that we order, overutilization of high-tech radiology. How do we effectively move people through the emergency room, get them to the floor in a timely fashion, have timely consultations accomplished, and get the patient back to his or her home, back to your office in a timely fashion, which is what all of us look forward to. Select Health Alliance is a physician-led project. Our board is comprised of 18 people. 14 of the people on the board are physicians. There are 4 administrators. The majority of the vote on the board is comprised of independent, non-aligned, not contractually related to a hospital physicians, so that we feel that the independent physician is well represented and the independence of practicing medicine is preserved. From its beginning, when we were developing operating agreements and contracts and looking at performance projects, performance processes and such, it was the physician who was in charge of all of these projects. We're the ones who developed the operating agreement, the relationship with various physician groups, and also with the hospital. Your physician network has been in charge of this project all along. As we come together and form this organization, we are hoping to improve the patient care experience, eliminate a lot of the redundancy of over-ordering of tests, improve patient care efficiency so that we help people in a timely, cost-effective fashion. Many of you are aware that there are multiple payment models that are changing. While fee-for-service is still the majority of how we are paid, and certainly Select Health Alliance is well positioned to negotiate very strongly for fee-for-service, payment models are probably changing, such as bundle payments or pay-for-performance or shared savings. Also, the Select Health Alliance is well positioned to investigate the Affordable Care Act and how that will impact us as a physician community. Select Health Alliance is a very important organization to the entire medical community of Memphis. If you have not become familiar with Select Health Alliance, or if you're already enrolled in Select Health Alliance and really don't know what you signed up for, please let me encourage you to come to our first annual meeting, which will be held on October the 29th in the Garrett Auditorium at 6 p.m. We'll have a series of presentations by fellow board members. You'll see how active your board is in developing a lot of the care process models that we've been working on for the last 2 years. I really want you to come and see the remarkable work that your fellow board members are doing for Select Health Alliance. That same night, Crimson, who is our data repository, Crimson is out of Washington, D.C., developed by some smart kids from Harvard years ago. It comprises about 900,000 doctors across the country who've been sweeping their clinical data into this data repository. It also has over 2,000 hospital networks in this as well. Crimson representatives will be there. Many of you are already familiar with Crimson but don't really know how to use it to look at your quality data. So we'll have Crimson representatives there as well that can walk you through what your Crimson website looks like, how you can go and look at your own quality data. That's what I like so much about this project is you are in control of your performance, you're in control of your quality, and not a third party. You're not being told what your shortcomings are by some abstract committee. You know exactly how you're performing. You're given information and tools to help you improve how you perform. And if that's not clear to you, you have a physician board that will facilitate that process. We truly are in this thing together to improve the care that we're delivering, to make it very efficient, to make it an outstanding healthcare organization that can address anything that's going on in our community. It is very well thought out. I'm very proud to come to you as the Chief Medical Officer. So I hope that you will be able to come to the Garrett Auditorium this October the 29th at 6 p.m. I look forward to seeing you then. Thank you very much.